the entire reason that I changed from my job in academic medicine to take a break was because of the time that working as a hospitalist allows for me with my friends and family. You have a lot of control over your schedule by utilizing the scheduling system that the company has for you. You can block time if you need to have family commitments. You can adjust your schedule on your shifts. They're very flexible as far as allowing for you to make the time that you need and take the time off that requires if something is to pop up. And then another great option is I have a really awesome team at my home institution. And so things pop up, the schedule's made very far in advance, which is really good for scheduling family outings and events. But sometimes things pop up and you need to take a day off that you didn't anticipate. So that's what's also really great is your home team works really, really closely with you on swapping when you need to. When I'm at the hospital, I'm locked in. That's my 24 hours, and I'm honed in 100% to patient care. But then when I pass off to my team member and I walk out the door, I also know that now I can be 100% honed in to my family. And that was a huge reason for me making the shift to this type of schedule is because when I leave the hospital, when you're in private practice or academic medicine, you never really leave the hospital or you never leave work. I think for me, the biggest thing is that I have my younger sister. She has an autoimmune condition that made her pretty ill and needing a lot more assistance from our family members. And she lives in Atlanta and I'm in San Antonio. So it makes it really difficult for us to help facilitate with her. And so while my previous employer was very willing to work with me, it's just difficult to say, hey, I need off 10 days every, 2 or 3 months to fly to Atlanta. And sometimes it comes at a moment's notice. I need to be there for 3 or 5 days. And that's really hard when you're trying to balance a clinic schedule and scheduled surgeries, not just with your employer, but for your patients as well. And so I think for me in particular, I love patient care and I love the surgery in the hospital setting. So working as a hospitalist really meets all the criteria that I'm looking for in my career, but I don't have the guilt if I need to leave for an extended period of time. Number one, that colleagues aren't covering my clinic schedule or my surgeries or that I'm letting my patients down. When your home commitments are a little bit higher, not only with my sister needing a little bit more assistance, but I have a 12 and a 7-year-old kiddo, and I just like to be there for their activities, and it just allows me a lot more flexibility.